Welcome back to Health and Beauty with Dr. Sonia. I'm Sharon Coleman, and with me, of course, is Dr. Sonia. Now, Doctor, before the break, we were talking about completely non-invasive body contouring treatments, and I know that you brought some footage with you. I'm really excited to take a look at what the experience would be like. Can we take a look?
Absolutely. And I'll run through what's going on here so you kind of get an idea here. So we had a couple of patients that had the treatment done, and the first patient here you can see she's getting a treatment done in the abdominal area. And what's nice is it's a very comfortable treatment. She's lying down. It's pretty painless and pretty easy. I mean, it's a lunchtime procedure. She can go back to doing whatever she needs to do after she's done. Basically, it's using light energy as well as heat energy as well as suctioning to basically target all of these areas. So the abdominal area is a great area. The thigh area is another wonderful area to do. And what's also great is that you can do it on all skin types. As long as you're a good candidate, we can do an ethnic skin as well. So the second patient that's getting it done is an African American, very safe. We always have to be very careful when it comes to ethnic skin because we can create more burns and more injury, but it's a very safe and a very comfortable treatment for all skin types.
How do you actually determine who the right candidate would be?
It's a very good question, and it's very important. Patient selection is key. Again, it is for somebody who is practicing, good lifestyle living, healthy eating habits, exercising the way, aerobic activity, and doing everything that they should be doing, but they just have little problem areas. So the abdominal area, the upper thighs, the inner thighs, cellulite. One of our favorite areas actually is doing the neck area because we can combine this procedure with some of our other minimally invasive procedures, such as laser liposuction, create wonderful results there.
Jeez, it didn't occur to me that you could combine some of the procedures to better enhance the area you want to target.
Yeah, and again, you're still you're enhancing the results, but less downtime.
Oh, fantastic. Now, tell me, so you've determined who the candidate is, essentially. They've come into your office. Do you guide them in terms of, this would be good, I want you to do it in conjunction with this is how long it'll take, how many treatments?
Again,
hold their hand?
Yes, of course, because people are scared. They don't know what to expect. It's anticipation of everything going on, and they want to see the results, but they're not quite sure, and they do need some guidance. And so the very important question is to make sure that they are doing all the right things in their life now to lose the weight, to lose the cellulite, to help with circumferential reduction or losing inches.
Okay.
And once they are doing everything possible, and they're maybe within 10 pounds of their goal, they're good candidates to do the procedure. And you're looking at doing a series of treatments, and within a couple of treatments, you'll start really seeing the results of toning, tightening, slimming, body contouring.
So nuts and bolts wise, I'm wondering how many treatments it might take to start seeing results, and how many treatments generally does someone need before they start seeing results?
Everyone does vary, and it all depends on, how much fat deposit is there, how much cellulite is there, but in general, you will start seeing results within 1 to 2 treatments, and will continue over 6 to 8 treatments. I always tell people to do sort of maintenance therapy as well, maybe once a year, because, we don't stop the aging process.
Right.
We don't stop all the hormonal imbalances in our body. So as long as they're doing everything that they can in their lifestyle, they're going to maintain those results, but they may need maintenance treatment
like a tune-up.
time. Yes.
Now, I know my sister-in-law is going to be very interested in this because she just had a baby. How soon after you have a baby, because she's seeing cellulite in places that she's never seen before.
Yeah.
How soon after you have a baby can you actually start one of these treatments?
Great question. Great question. Obviously, women's body goes through a lot after having a pregnancy with all the hormonal fluctuations you've been through. I just had my first baby, so I know what it feels like to go through all of that body changes. What's nice is that you can pretty much get into it very quickly as long as you're not breastfeeding and you are very close to your goal weight or pre-pregnancy weight.
Okay.
So if you've got a ways to go, you should probably wait. Certainly if you're breastfeeding, you should wait. And again, results will vary. What's nice is that you'll definitely help to tighten the skin, but that skin laxity may not completely tighten up to how you were pre-pregnancy, but you'll notice a great improvement. And it's a very common population that is really inquiring about these procedures.
So, if you just have had a baby, or maybe there was something else that you've had to your body over a period of time, and maybe you're a little bit more sensitive, do you need to be concerned at all with this treatment maybe hurting? Does it hurt at all? Is it painful.
It's a very safe treatment. You can see that our patients that we were looking at were very comfortable. They were able to do their daily activities right away. And what's nice is this laser, the vellus shape, is actually the only one that's FDA approved for both cellulite reduction as well as circumferential reduction, which means losing a couple inches,
sure,
losing a couple of dress sizes. And I always like to kind of explain what happens with cellulite treatment, and so I've kind of have this prop. I'm using this as an example here.
Sure.
You can see that we have the upper layer of the skin, which is called the epidermis, the lower layer, which is called the dermis, and then the third layer, which is the fat. That's our problem area.
That's the problem that you're treating right there.
What happens over time is these fat cells get enlarged and they basically push up into the skin. And also what's happening is there's some connective tissue bands that are starting to form. And what happens is that it's pulling the skin down, causing a puckering effect, kind of this dimpling effect up above. And so that's what you see with the irregularities.
Yes. With this treatment.
I'm targeting the fat and the connective tissue.
Well, we sure have a lot more coming up, including a sit-down with one of Dr. Sonia's patients. So stick around for more Health and Beauty with Dr. Sonia. If you have any questions for Dr. Sonia, please visit EliteMDSpa.com. Click on the link for Health and Beauty with Dr. Sonia. We just may answer one of your questions on our upcoming segments.